environmental cleaning and waste management. This is also a very critical IPC standard precaution that your facility should adhere to strictly. And we have provided different guidelines, the SOPs, for all those key processes. So you can quickly just download them and make use of them. For example, how to mix disinfectants, just download and follow. How to manage linens of patients or linens of health of staffs. Management of spills, if an infectious agent has spilled on you, especially if it is during a Ebola period and in the ETU. So such guidelines are there, but this one may not apply to you for Ebola. But still, all spills of the patient of an infectious agent should go through the proper steps of management, and you should adhere to that. And all the SOPs are there. So that's what we will look through briefly. So we are saying here that SOPs for all these processes are there. You can access them. But besides that, cleaning of your spaces in the facility, whether it is the floor, whether it is the door knob, whether it's the table, where the working table, the surface, you should follow the procedure for that. And the right procedure for now is that preferably surfaces should be mopped other than spraying. Spraying in the past, the other time of COVID-19 was spraying a lot, but as we discussed earlier, it doesn't give us the 10 minutes of exposure so that you can achieve your intended outcome. So you may not have that 10 minutes exposure with what you have sprayed. But when you mop, that's where it's effective. So mopping is what is recommended for you to clean your surface of a table. For example, you can use absolute alcohol and then you mop it with it. You can, for the floor, use 0.5 for your floor of your facility. And when you are mopping using the mop, you have a 10 minutes contact time, and that becomes effective. So you should allow the surfaces to be dry before you make use of them, because some surfaces might be very slippery for your patients, and that's why the guidelines are there. So you should follow those guidelines. So the other thing is that once you have used a corrosive substance, chlorine, on a metallic surface, again, you should be able to rub off this, wipe it off with clean water so that you don't spoil your metallic surfaces. So those are the key things that we are saying. Mopping and spraying, we have now moved away from that. Studies have shown that doesn't give the 10 minutes contact time so that it can achieve the effect. So mopping the surface is what is now required. And as well, cleaning and disinfection is recommended to minimize the pathogen contamination of the environment. So again, just to highlight, all the surfaces should be prioritized and appropriate decontamination measure followed up. And these measures are all given here. Whether you want to decontaminate the floor, whether you got a contact with the body fluid of a patient and you want to clean it up. So all different procedures are there and you can be able to download them. I've just given a highlight of it. So moving into waste management, for your facility, a lower level facility, you don't incinerate your waste, I'm sure. But what happens to you is that you generate the waste. So at the point of waste generation, segregation of waste is very critical. It helps a lot to also minimize the cost of managing your waste as a facility. Because if you put the papers, the boxes, the caveras of whatever you're going to remove, all those caveras will carry weight, and you should therefore segregate them, because a cavera of those are just the same cavera as that of the home. So if you segregate them, you can be able to manage that one effectively. And then the highly infectious content and are now the ones that quickly should may be the one that spends your money, because you may be required to have an accredited company that will come and collect them up, transport them, and store them somewhere in their facility, manage them through the appropriate incineration procedure, and ensure that the end point is achieved. So for you, the first 2 years is very critical. Segregate your waste very well, and ensure that the accredited company comes regularly to pick up this waste. The standard that the environmentalists require is actually daily collection of waste, but we know that sometimes they take so long, and the risk of taking long is that they liquefy and start leaking as liquids, and these are very high infectious content, and they compromise a lot about the health of your staff, the fellow healthcare workers, and also other patients. So that's the key thing I want to pass on this. And so for your facility, there should be a waste management plan for your facility. How, having generated the waste, what plan is there in place? So people who will come for your facility will eventually want to know that, so that they see how you adhere to that plan. So as a summary, give me a minute. I want to, I have common call, give me a minute. So thank you, I needed water. So as a summary, you should have observed the standard precautions at all times. And there should be a focal person who observes that the different staffs are trained and they adhere to that. Also, screening of all patients who are entering your facility, and inpatient screening is very important, and you should adhere to that. Especially now that we're in a recovery phase, we don't want any infection to come up, and I mean the Ebola case to come up again and spread unknowingly for some weeks before we actually realize that there's a problem. So the other thing is that your facility, through the screen, the scorecard assessment, was scoring badly because of lack of a holding area, and that's why we are discussing today. So under recovery phase, we need to build back better. So you should be able to make provisions for a holding area in case you find something that is of public health value and you're calling KCCA. There should be a designated space to hold the patient effectively and comfortably. So that is one of the points for us to improve now that we're in a recovery phase. And that's the meaning of recovery phase, therefore. Training of healthcare workers on environmental disinfection, waste management should be done in your facility. You should be able to observe that, and that's why we want a focal person for your facility to be trained and follow up and make sure all this is done. Also, as a summary, we are saying screening is followed by isolation into the holding area, and then you notify the KCCA, making sure that you don't have any contact with this patient. But if the patient is critically ill and you want to have some basic management of that patient while KCCA is coming to pick up the patient, then therefore you should have a minimal, you should have an appropriate PPE worn, and you should offer minimal care to that person just to save life, basic care, and then KCCA comes and takes over to pick up the patient. And of course, when they pick up the patient, it is the patient is transferred to of course, to people of high training. For example, people have trained on Ebola frequently, the physicians and all that, and they have managed Ebola very well. So let them be the one to do the management. So our work is to see that they are transferred. And when they do, this is the other part of decontaminating the surfaces of the facility after any event of that caliber. So you have to make sure all the surfaces are decontaminated very well. And mostly this decontamination is not done by you. Once you have signaled a case and a case has been found, there is what they call the ring IPC, and the ring IPC team will come to decontaminate themselves so that they are sure nothing is left unturned. So this is what happens. Now, if you don't do this, your surfaces, you see the cascade, your surfaces in your facility will not be decontaminated and your staffs will be at risk. And that's how infections come up. So by screening and isolating and notifying, all the cascade of event occurs and your staff becomes safe. And that's why we are training, we are discussing this now.